A horizontal tear to the meniscus occurs when the superior part of the meniscus becomes separated from the inferior part, creating a gap in the middle of it. This method of repair involves extraction of blood from the patient to develop a blood clot that is used to aid the healing process of the meniscus. The joint is visualized using an arthroscope, and the structure of the meniscus is secured back into place using sutures. Before tightening the sutures, the fibrin clots are inserted between the separated layers of the meniscus. The sutures are then tightened, and the clot allows the avascular regions of the meniscus to heal effectively.